Thank you so much for joining us for another awesome episode of Bioenergetics Beat. I'm Heather Gray, a functional diagnostic nutrition practitioner and bioenergetic practitioner, and this episode is brought to you today by Nikki, Unleash the Wellness Within. It's a non-invasive, easily affordable, highly effective approach to optimize wellness. It's a wearable device that puts frequency better based life in your hands and on your wrist. Make sure to stick around to the very end. You're not going to want to miss 1 minute of my next guest because he's absolutely amazing. But we always also have an incredible giveaway that you're not going to want to miss out on. So make sure to stick through to the very end, and we'll welcome our guest today, Mr. Peter Kahn. Thank you so much for joining us.
Thank you so much for having me.
Yay. You are just done such amazing things in this world, and you're probably one of the most humble, like approachable, down-to-earth guy I've ever met. It's such a beautiful and rare combination to see sometimes in this field when someone gets to be as freaking awesome as you are. So just thank you for that.
You're being way too kind.
No, it's the truth. It's the truth. So tell us a little bit about yourself. What kind of a doctor are you and what kind of a practice do you run and what got you into this line of work to begin with? Because I found a lot of the alternative practitioners out there have some sort of pain to purpose story, and I'm just curious if you're like one of those.
I do have a little bit of pain and purpose, a little bit of both. So I'm a board certified chiropractic neurologist. And so within chiropractic, we have subspecialties, kind of like medicine have specialties like cardiologists and neurologists and so forth. Chiropractic, we can go to extra schooling and take a very rigorous board certification to become board certified chiropractic neurologist. And as a board certified chiropractic neurologist, our goal and job is to help to identify what area in the brain and the nervous system is not working and use non-invasive methods to rehab and rehabilitate and stimulate the nervous system back into normal function. Now, I got my start. Let's go all the way back to my start. I was born in Taiwan, moved here when I was 12 to the US. And so I have a kind of a Chinese background when it comes to diet and nutrition. When I grew up, it was always emphasized that, hey, eat the eyes, it's going to benefit your eyes. Eat the liver, it's going to benefit your liver. So nutrition and food is kind of medicine for us in a Chinese culture. So I was kind of born or grew up that way. And when I went to college, I have a degree in exercise physiology and minored in nutrition. Of course, that type of training is very mainstream, very allopathic, if you will, right? And so I didn't know anything about functional medicine and functional nutrition. Of course, back then that wasn't even a thing. Now, fast forward, I went into chiropractic school, and my father was diagnosed with liver cancer, and he was 75 at the time, and it was stage 4. They said, there's nothing we can do. Get your affairs in order. So my brother and I, my brother is also a chiropractor. We basically just try to do everything we can to help our father, and with just a little bit of things that we knew, right? We didn't know much. We just gave him very basic, like liver support, milk thistle, make some diet change. And my father actually lived 5 years symptom free from stage 4 liver cancer at 75. And at that time, doctor was scratching their head like, this guy is not supposed to be around. So that really taught me a lot about the body's innate ability to heal itself. And then when I got married, my second child, which is my first son, he had a scalding injury, hot boiling water spilled out on the side of his body. So he had this burn injury. And after the burn injury, he started getting asthma, food reactions, night terrors, behavior problems. At the time, we didn't know what was going on. I thought he was going to become autistic. So that led me down the road into studying functional neurology. I got my fellowship training with one of the world's leading expert on autism and child development disorder, and subsequently got my board certification in chiropractic neurology, all in an effort to try to figure out my son and help him. And then fast forward some more, my third child, my daughter, when she was just a baby, 9 months old, crawled up to Big Brother's leftover lunch of cheese quesadilla and took a bite, and she got anaphylactic reaction to dairy, to the cheese. So she had to be rushed to the hospital. And I just remember seeing the back of the ambulance with her, and I was like, I'm going to figure this out. So that led me down the road of studying functional medicine, studying, food sensitivities and leaky gut and so forth. And then so I started combining that in my practice, combining neurological treatment with functional medicine. And I developed this method called NeuroMetabolic Integration that combined both of functional neurology and functional medicine. And that allowed me to really help a lot of people with chronic conditions that previously just nutrition wouldn't cut it, just functional neurology wouldn't cut it. And so that's kind of where I am now, to really get the message out and teach people that there's a brain immune gut connection. And you may have to tend to all these areas in order to get complete healing.
Absolutely. See, when I speak to so many people that sometimes I forget who they are until you start talking again, and then I fall in love with you all over. So I think it was Dr. Amy Apigian. You were on one of her summits, and I think that's where I first heard about you, because this whole thought, because you talked about your son's injury and then all these symptoms afterwards. And so I'm guessing trauma had a big piece to do with those symptoms, correct?
Yeah, I think at the time, I was just more focused on the physical trauma,
Right.
right? The, the,
Yeah.
the reality is that that burn injury caused major inflammatory response and most likely leaky gut and most likely neuroinflammation as a result of that. That's led to a lot of his sensitivities and allergies and subsequent asthma and even neurological behavioral issues. But there's also the trauma, right? Even as a 2-year-old who got severe burn injury, there's got to be an emotional component as well. That's probably something that I didn't really address till much later on, but initially was more focused on the nutrition aspect of it.
Right. You know, a lot of us good functional practitioners, right? We're great at focusing on the body and doing the supplements and doing the functional way. And we forget about this other piece to that, the nervous system, the trauma. And I think it's so beautiful that we've got so many more people talking about the whole connection. So that way a person can actually get better. You know, recently I'm learning about my own nervous system, and I started twitching in the evenings. Like it's this weird, and it's only in the evenings. You know, and this doctor that I'm working with said that it has a lot to do with my nervous system just being out of sync, out of control. And I know that's what I've been working on, you know, lowering the inflammation, getting out the trauma. That's what I talk about all the time. And so it's just fascinating to see people who are actually putting these pieces of the puzzle together. So that's just so freaking awesome. And I didn't know chiropractic, you could specialize like that. Like that's amazing.
Yeah, there's chiropractic, sports physicians,
Yeah, I
chiropractic
guess I did know about that.
orthopedist.
Yeah.
Yeah, so
But
there's
nothing directly towards the brain, but it makes sense that it's connected to the nervous system because that's chiropractic does. So that totally makes sense. Beautiful, beautiful, awesome. Well, let's take a really quick break. When we dive in, we'll get deeper into the inflammation impact on the brain immune gut axis and why you should care. And I'd also love to hear, you know, a little bit of like, you know, the what happened next, you know, with your son and your daughter, right? Like, you know, because we heard about your dad, like that's incredible. But we'll dive deeper into that when we come back. Don't go anywhere. Stay tuned. We'll be right back.
Hi, my name is Stephanie. I came to use the Nikki actually through my sister who was working for the company at the time, and she had been speaking to me about the frequencies on there and how it had really helped with stress and anxiety and things like that. And I had thought, well, I have stress and anxiety, maybe this can help me too. And in addition to therapy and other things I was trying to do to help myself, I thought this might be an additional tool that would help me. The nighttime frequency really helps me with my sleeping. The pain frequency, I have some issues with my shoulders and that seem to have gotten a lot better. These things I knew nothing about when I got it. So it kind of morphed for getting it for one reason and kind of helping with other things. I found actually the biggest benefit I've found is I am prone to UTIs. And I was always on medication, always going to the doctor, always getting them. And the first time I got one after I had the Nikki, I thought it has the viruses and bacteria. Let's try it. Well, since then, I've had it for over a year. I've had normally would have about 5 to 6 UTIs in that time. I've had 2 that I've needed medication for, and the rest I feel it coming on. I put on my viruses and bacteria, and within 3, 4 days, it's completely gone. I don't have to have medication. I don't have to go to the doctor or do anything like that. So it's been in that way life changing for me.
Nikki puts a personal wellness center in your hands and on your wrist. Be better. Do better. We are Nikki.com.
Yay, welcome back. Let's dive deeper. So you had me on the edge of my seat. So then what happened with your son and with your daughter?
Yeah, so basically with my son, once we learned about this neuroinflammatory issue, we also discovered gluten. So that was the early days of, learning about gluten and the impact on the brain. And so we went gluten-free with my son. And I would say it did help him, and it took time, right? Because it's not like you just cut out gluten and that's the only thing that was causing problem. Because prior to that, it was a burn injury, so he had to heal from all these inflammatory issues and the wind up of the brain immune gut axis that's kind of resulted in his symptom. And then when we discover about my daughter's allergies to dairy, then we started to really test everybody with food sensitivity testing and find out what actual allergies and sensitivities they had. We discovered that they all have multiple sensitivities and multiple allergies to different things. So then that got us to do a more cleaner, if you will, diet, kind of like resembling paleo, although not quite. They were able to have some gluten-free grains. Through that process was very difficult because it was in the early days. There weren't that many choices in a store that's ready to go. So we had to make our own gluten-free bread. We had to do a lot of things ourselves. So I think it was necessary, but the dietary choices was limited, right? So in some way, that's probably not good for them, but it needed to be done because they couldn't keep eating the food that they're sensitive to and driving out the reaction. So the good news is that after several years of doing that, right, just like man, kids, birthday parties and stuff like that was very difficult. We finally got to the point where we felt like they were better enough, and we did some follow-up testing, and we said, okay, it's time to bring some food back. Let's see how they do. And we were able to bring back a lot of the foods that they were once sensitive to without problem. So that widened up their diet, which was really helpful. So that, again, that taught me something, right? That taught me that, hey, food reactions not necessarily forever, depends
No.
on the person. Sometimes these food reactions are transient. They come and they go, depends on your leaky gut, depends on other things. So, so the fact that they can get better from that means that other people and patients can get better too.
Yeah, the food's got to be quite different from the food that you grew up with, right? Because it sounds like you grew up with more of a functional, cleaner, healthier diet, and then you move here, and what are you guys eating like in back in the day, right? You're probably still eating a little bit of the standard American diet, or was it just more of like the gluten and the dairy, not so much the processed stuff that was getting you guys?
Well, yeah. So, just to remind, when you say the stuff that I grew up with, I grew up in Taiwan. So I always joke around because in Taiwan, we ate just, like very locally fresh food. And, it's just stuff my mom go to the local market, bought the food, bought the chicken. The chicken was slaughtered right there. We brought it home and you ate it, cooked it and ate it. So, I always joke around that I have a third world country gut microbiome. So, I kind of have a pretty tough, GI tract, it's always like, bring it on, whatever food you like. I can tolerate a lot of things. As far as my family goes, at the time it was, again, a lot of when we made the change, we have to go to more like fresh and, whole foods and prepared our own. Prior to that was just pretty standard. Yeah. Because we didn't have the awareness, right? That's where education and awareness come from. And the good news is that we have so much more information. In fact, I feel it's almost too much information. People get too overwhelmed. They don't know where to start. And that's a lot of where I come in. I try to help people to direct them on the right track so they're not chasing rabbit holes that they don't need to chase.
It's tough. And yeah, and it bothers me. There's so many people out there doing food sensitivity testing, but they're not following up with their clients properly. And I'm working with people who have been avoidant of these foods for like years. And it's like, wait, they never worked with you on, introducing these foods back. Like this is not how food sensitivity testing is supposed to go. Like, right. You're supposed to kind of stay off something 3 to 6 months, work on healing the gut, and then try to reintroduce things, not, keep things small, because that's not really great for your microbiome either.
Absolutely. Yeah. Diversity is key. And we don't want to necessarily restrict if we don't have to. Now, granted, some people, they're so sick that they must be on a strict diet for long term just to maintain their condition, right? Some people with certain type of autoimmune, that's just kind of what they got to do to maintain function. And that's all good. If you know what you need to do to stay, symptom free, that's great. Because some people, they go on all these diets, it's still not all the way better. That's really tough, right? So for some people, they do have to stay that way. But the goal is always to bring them back, to introduce more food as possible.
Yeah, absolutely. I am that person. I'm the canary in the coal mine. We talk about people having a detox bucket. I have a detox thimble. And so I'm one of those that has to walk that straight and narrow line. And I have tried and I've done so much healing. And operate just fine if I just avoid these certain foods. So I'm, done messing around. I just avoid foods. I don't drink, it's a healthier way to live anyway. And as soon as you kind of get in the right mindset, it's not that hard. These days, it makes it a lot easier to have healthier choices. Traveling sometimes can be hard, especially in certain like airports. Like when we go into Dallas, like I found no healthy options in the Dallas airport, but here in the Denver airport, we've got, Mod Market, and there's a few different healthier options. So, but the world is starting to wake up, thank God, and we're starting to be able to find, whole fresh food in places where you couldn't. So let's dive in more into the inflammation impact on the brain immune gut axis. Can you break that down a little bit more?
Yeah. So, I think a lot of people heard of the brain gut connection or the gut brain connection. Depends on who you talk to. If it's a gut specialist or someone who's focused on the gut, they'll call it the gut brain axis because they're more focused on the gut. And then if you talk to the brain guy, then they're going to say the brain gut axis because they think the brain is more important. The reality is a bidirectional pathway, right? So the brain influence the gut, gut influence the brain. But the problem is a lot of time people just think it's brain gut. So, if I can just shove some probiotic down there, then my brain's going to just get better. Or it's my brain gut. So then if I just take some, 5-HTP and St. John's wort, then my brain will work better and my gut will work better. But it's not that simple. So I really made an effort to really, I believe I'm the first one to coin this term called the brain immune gut axis, or brain immune gut, acronym BIG. So I call it the big axis, or the big idea in functional medicine, that it's not just the brain gut, it's the brain immune gut. In fact, I have even gone a step further to kind of make this connection. It's brain immune gut endocrine connection. So now it's Biggie, Notorious B.I.G.
The song started playing in my head. Hey, Biggie.
Yeah, can't get out of your head now. But yeah, it's a multiple communication pathways, and that's how the body works, right? It's all these different communications through chemical messages, through cytokines, through hormones, as well as through energetic pathways and frequencies and light communication through biophotons. So it's all just this big soup, right? That's driving us toward optimal health, to drive us toward adaptability to stress. And so the idea is that this brain immune gut and now endocrine connection is that when one area in this connection fails, the other areas along this axis fail as well. So for example, if someone has brain issues, okay, how would you know you have brain issue? You have brain symptoms. What are brain symptoms? Fatigue, brain fog, short-term memory issues, depression, anxiety, right? These are classic lack of motivation, bipolar disease, whatever disorder, whatever it is. If you have brain symptoms, that means your brain's not working right. Pretty straightforward. But know that if you have brain symptoms, that means other parts of your brain immune gut endocrine axis will start to become disrupted as well. So you don't just, it's not confined to the brain, right? So if you have brain symptoms, very likely you can start to have gut dysfunction as well. You may not realize they're connected, but they are connected. So some people, they say, I have fatigue, I have brain fog, but then I also have like gas and bloating. But they're separate things, right? One is the gut, one's the brain. So I got to do something for the brain, I got to do something for the gut. But in reality, they're kind of connected. So in fact, they're all connected: brain, immune, gut, endocrine. So the way that shows up is usually when people have brain symptoms like fatigue, brain fog, short-term memory loss, and so on and so forth, they also may have immune system problems. Well, how does that show up? That might be allergies, chronic infections they can't clear. They may have chronic sensitivity to different foods, right? Multiple sensitivity. They may be sensitive to chemicals. They may have autoimmune disease. They may have chronic inflammatory issues of joint, skin, and whatnot. So that may show up as immune system challenges. And on the same token, the gut can be affected. So they can have decreased motility, resulting in fermentation, causing SIBO or SIFO, small intestinal fungal overgrowth or small intestinal bacterial overgrowth. They may have gas, bloating, reflux, heartburn, all these GI symptoms. And then furthermore, they may have endocrine dysfunction. And endocrine could be thyroid dysfunction, could be adrenal dysfunction, could be sex hormone dysfunction, could be pancreatic hormone dysfunction, like insulin resistance and insulin problems. So usually they run a gamut. So when I start to see people with chronic condition, whether it's Lyme, Heather, or mold, or they have fibromyalgia, or they have Hashimoto's. Invariably, they always have brain, immune, gut, endocrine symptoms. Maybe not all of them, every single one, but usually there's multiple buckets of those brain, immune, gut, endocrine dysfunction that's happening at the same time that looks very similar. So people with Lyme, they have the same brain, immune, gut, endocrine symptoms. They look very similar to people with mold, look very similar to people with Hashimoto, very similar to people with chronic fatigue syndrome. The reason is because once one of those buckets fall, the other buckets fall with it. So then we stop treating the individual symptoms, but we're looking for the root cause. And we're looking to how to re-establish balance between the brain, immune, gut, endocrine axis so the body can heal. And this makes it easier for us to manage these chronic patients. It makes it easier for the patients to manage themselves because they know what they're up against and they know what they need to do.
It's so frustrating because we've compartmentalized in the medical industry for so long, right? And even mental health experts, you have anxiety, you have depression, oh, you go on an antidepressant, antipsychotic, mood stabilizer, right? And it's not necessarily a condition of the brain, like we just talked about, right? You could have a condition of the gut and there's inflammation here, and it could be autoimmune kicked off, like viruses, bacteria, Lyme, like there could be so many other things other than just a deficit in neurotransmitters, and that's kind of still where we're at. Like if we would have been talking about this stuff back when I was 13 and had my first suicide attempt, like how differently I may have been diagnosed with Lyme disease, right, and a leaky gut and celiac, instead of labeled as crazy and put on an antipsychotic and left to go out into the world still ridiculously sick. Like these conversations need to happen more and more, and they need to get out there because there's too many people still suffering, right, needlessly. Like it needs to stop.
Yeah, and then there's also the stigma associated with people with depression and these chronic conditions. They're told that it's all in their head, and so yeah, I mean, people need to know that there are answers and there's hope, and that they don't have to get labeled and believe in the label, right? And the diagnosis is just a label, but what's the underlying root cause? The label doesn't tell you anything about the root cause because there could be 10 different things causing the same label of depression, 10 different causes that can cause the label of, chronic fatigue. It's more important to identify the mechanism and the cause, both. And there's a difference between mechanism and cause. Mechanism means like what is happening on the cellular level, on a physiological level, that's driving the dysfunction and driving the symptom. The cause will be what are the actual triggers that are continuing to, right, cause that dysfunction, that mechanism to continue to exist. And oftentimes we need to address both the cause and the mechanism, because if you just remove the cause, if a mechanism is already happening, like the brain, immune, gut, endocrine axis dysfunctioning, it's already happening in a vicious cycle, and oftentimes it occurs in a vicious cycle. If you don't wind down that vicious cycle, you can remove the cause if the body is already in a wind up mode, already in autoimmunity. So you have to calm that down as well. That's understanding the mechanism. And then at the same time, remove the trigger, which are the things that may be ongoing that's causing the condition to persist.
Absolutely. So where do people start? Because, this sounds kind of like, to a regular person, like a tangled mess, like, so how do you get started with people?
Yeah, so a lot of time people's like, okay, brain, immune, gut, endocrine axis. I get it. They're all connected. How do you fix it? Do you start with the brain? Do you start with the immune? This is where the mechanism comes in, right? Because it's actually not necessarily, you don't start necessarily with the brain or the immune or the gut. The roadmap that I use is actually, we want to address like physiology in a way that's going to help the body to be able to build up its foundation. Okay, so what's the foundation for the body to heal? Well, first, it requires energy, right? Without energy, your white cells can't kill things. Your detox pathway doesn't work. Your brain function cannot summate, so you can't fire the vagus nerve, right? So for your people talk about vagus nerve function, right? Because vagus nerve is one of your primary drivers of parasympathetic function. But vagus nerve, just like all other neurons, require fuel. So if you don't have enough fuel going to your neurons, then those neurons are not going to fire. Imagine if you haven't ate food for like 5 days. It's kind of hard for you to like stay alert and do a big test or whatever, right? So you want to be well fueled to be able to function. So the first priority is actually fuel delivery, right? What does that mean? We have to deliver the substrate necessary for your mitochondria to produce ATP, right? People talk about mitochondria support, like taking CoQ10 is gonna like make your mitochondria spit out more ATP. You need CoQ10, sure, but what drives mitochondria to produce ATP is actually like food, right? It's actually energy, it's actually fuel. And that fuel comes in the form of oxygen and glucose, right? We breathe oxygen and that drives mitochondrial function. That's the primary. And then it's glucose, right? Now, protein, fats, and carbs, they all eventually break down to glucose. Fats can break into fatty acid, go into ketosis pathway. But primarily, the easy fuel for us is glucose. That's a primary fuel. So without proper oxygen and glucose, things don't work right. And a lot of people have these subclinical oxygenation problems that show up as, anemia of various types. Okay, there are many different types of anemia. Not all of them have to do with iron deficiency. So it's important to identify and diagnose the proper form, like what's the reason for the anemia, and then address the specific mechanism for that anemia, right? Because if you have anemia, you can't carry oxygen in the blood, that's going to compromise your energy. And then you can also have an oxygen problem in the form of poor perfusion, right? Perfusion is the ability to deliver blood to your tissue, and that's through circulation. So if you have circulatory problem, that can show up as cold hands, cold feet, your skin's not right, your nails like blanched, and your hair quality sucks. These can all be circulatory problems. And then also low blood pressure could be another way that this shows up. A lot of people have like these low blood pressure issues, and they're told that, oh, your blood pressure's, you don't have high blood pressure. That's so good. You're not going to die from like stroke. Well, low blood pressure is just as bad because you can't get blood to your tissue, specifically to your brain, then you're not going to feel great. So these are like underlying oxygenation problem that's often overlooked in both conventional and natural alternative medicine that people don't really properly assess and help people to get to that optimal stage. That's just the oxygen part. And then there's the glucose. So glucose dysfunction can come in 3 flavors, no pun intended. It can come in the form of hypoglycemia, right? Low blood sugar, can come in the form of insulin resistance, which kind of drives high blood sugar. It can come in the form of a mixed pattern where your blood sugar is low and high, like a roller coaster, blood sugar instability. That's also going to drive problem because your body hates that. Your body likes to have steady fuel, right? Part of that is from eating, but part of that's from hormonal regulation through cortisol, glucagon, and insulin and various different hormones in the body that regulate your blood sugar so that even between meals, your body can release glucose from stores to be able to keep that steady. If you don't have steady blood glucose, your brain function, your cell function is not going to be great. So oftentimes that's where we start. Just by working on that fuel delivery part, people already feel better. And even if they're not all the way better, now they have the foundation to be able to be better, right? Because if your fuel delivery is compromised, you're not going to be very successful in doing detox because you don't have the energy for the machines to work to do the detox. If your fuel delivery is compromised, you're not going to be able to get rid of pathogens and parasites and Lyme and viruses because your immune cells also need energy to do their job, right? Immune cells not just out there killing things and they just work on like, I don't know, like quantum quarks or something. Like it works on freaking energy, right? And energy come in the form of caloric and nutritive value, right? So we got to eat. That's why nutrition is so important. So that's kind of the first place I start with people.
That's why I love bioenergetic stuff, like the Nikki kind of helping the body on the bioenergetic piece and then the functional piece, right? That's really what functional medicine does so well a lot of times is focusing on the lifestyle pieces, right? Once you dial those in, because it's amazing how off track we've gotten as a species, and just like you said, just dialing in somebody's sleep, and recently through these lovely trackers that we have these days, I found out my oxygen was dropping to 83% at night when I was sleeping. And that was fueling my brain fog the next day, right? Cognitive issues, so all the supplements in the world weren't really doing me and my brain fog any good because I was not getting enough oxygen when I slept, and my cortisol was going through the roof. Like, you should have seen the stress spikes. It would tell me, slow down, you need to relax. It's like 2 o'clock in the morning. I'm sleeping. I'm like, I don't know how to relax any more than that. But when your body thinks it's dying because it's not getting enough oxygen, it's crazy the downstream ripple effect that has. So thank you so much for bringing in just those little pieces. I think it's not sexy. So I think a lot of people, they're wanting to talk about the new latest, greatest technology, and really getting back to the basics is where it's at, right?
Absolutely. That is really the takeaway message there, is to focus on the primary needs of yourself, right? The basics. Because if you're trying to do like some fancy stuff, that's like 10 steps down the road. You may still need to do that. You may need to detox and do whatever, right? But if you don't get the basics right, kind of just what you just said, if you're nighttime due to sleep apnea, due to whatever it is, somebody's not getting air in when they're sleeping. Number one, they're not getting air in. That's going to compromise oxygen. Number two, they're not getting good sleep. Then that compromise everything. So no amount of detox and supplements is going to do you any good until you get that right. So it's really not just about fuel delivery. It's really about the mindset. Like, are you after truth? Are you after what's really the underlying culprit? That's the biggest needle mover and the biggest driver for you. Because if you can hit that biggest needle mover and the driver, you're going to get the majority of your wins from that. And then you can work on the rest doing the more advanced stuff. But if you don't have the basics down, forget about it, right? We need to exercise, we need to sleep, we need to eat properly, we need to eat real food, we need to stabilize your blood sugar. Like, we need to get that dialed in before you even consider all these other fancy stuff.
Dr. Khan just dropped the mic on us, like, boom, mic drop. Yes, exactly. Thank you so much. Now, this is the shameless plug time of the show. Where can people find you? What are you putting out there these days?
Thank you so much for letting me share. I have a YouTube channel that's very robust, a lot of free content there to help people to be able to learn about, the various things we talked about, the foundations and the more advanced stuff as well. So they can find me at YouTube. Just type in Dr. Peter Khan. The bald-headed Chinese guy will pop up, pretty easy to find. And then also my website is at askdrkhan.com for more information.
Fantastic. Thank you for doing everything that you do. Also, make sure to check out wearenikki.com/podcast. Enter in BioBeats for 10% off. Also, make sure to check out the show notes and enter in to win your very own Nikki with the wellness frequencies. You could win it for free. So good luck to you. We want to say congratulations to the winner of May. They get a Nikki personal frequency delivery system and the wellness suite of frequencies. That's a $598 value. Congratulations to Marcy O, Philip S, Leron G, and Brandon L. Congratulations. And if you didn't win, try again next episode and make sure to share the love. Thanks again for joining us. Have a healthy day. Stay tuned, join us again. Good luck and thank you. Bye-bye.
There's a new word for wellness, Nikki. Nikki, the bioenergetic wearable designed to help you feel better and perform better. Other wearables just track how you're doing. Nikki is about helping you do better. Nikki takes bioenergetic frequency science to a new level and onto your wrist. Nikki technology carries frequencies into the body to organize and optimize the cellular network, the trillions of cells that communicate by light and frequencies to keep us alive and feeling our best. Physical and mental trauma can upset cellular communication, and Nikki is designed to help restore it. Touch the Nikki screen to choose the frequency you want for what you want to do and how you want to feel. Low energy? Touch energy for a boost. Stressed out? Stress and anxiety is to calm you down. Aches and pains? Choose Nikki Pain. Nikki has frequency sets intended to fight allergies, strengthen immunity, and keep viruses and bacteria at bay. If you're going on a trip and want to arrive fresh and ready to enjoy your vacation, touch travel. And if you want to wake up ready to go, Nikki Nighttime is for overcoming daytime trauma while you sleep. Every Nikki comes loaded with a full inventory of frequency set, including pain, energy, travel, immune, stress and anxiety, viruses and bacteria, allergies, insomnia, daytime bundles, nighttime bundles. Nikki puts a personal wellness center in your hands and on your wrist. Be better, do better. We are Nikki.com. The views, information, and opinions expressed in this content are solely those of the individuals involved and do not necessarily represent those of FreeMedica. FreeMedica Technologies, Inc. and its employees are not responsible, nor verifies accuracy any of the information contained in the following content. The primary purpose of this content is to educate and inform. This content does not constitute medical or other professional advice or services.